Richard Girk's worsening hip makes every step painful.
It's something like a pointy blade of a jackknife inside pressing on it when I bear weight on it.
Girk waited 2 years to see an orthopedic surgeon, only to have that appointment canceled by the pandemic.
Well, I'm a patient guy, but it's frustrating. I know I'm not the only person with this story. I know there's more than likely hundreds or thousands of me.
Most non-urgent surgeries have been canceled in Canada, everything from hips to cataracts. So a new waitlist crisis is brewing.
So this is data that we got from...
This surgeon is urging provinces to adopt a not-so-radical approach to getting through the backlog. Instead of patients referred to a specific surgeon for their operation, he proposes a bank teller approach, where patients go into a single lineup for the next available surgeon, even if they're in a different hospital or even city.
Imagine you're waiting for a hip replacement because you can't walk, and you happen to be in a queue that's 13 months or 14 months where you need to wait for your hip replacement, instead of waiting 6 weeks, which might be the next available appointment for some other equally qualified and excellent surgeon.
Tip your head back a bit.
Family physicians also expect to see a flood of patients. Physical distancing and strict hygiene standards will make that even harder. This physician has co-authored a 5-stage plan for fellow doctors to begin seeing patients gradually, starting with high-risk cases. Less urgent matters such as screening and chronic disease will have to wait until next year.
So we really need to make sure that it's only the very, very small number of people who are coming into the office, whereas most people should continue to get their care virtually, either by phone or by video.
In a healthcare system already stretched, these changing times require a change in expectations. Vic Adopia, CBC News, Toronto.